Hi, this is Jody Tropiano, Content Director with Health, and I'm lucky to be here with patient leaders Kristal Kent, Candace Lerman, and Frank Rivera. So thank you guys for joining us today.
Thank you for having us.
Yes, thank you very much.
So first, would love each of you to give an intro to our community and tell us a little bit about yourselves and the communities that you are a part of.
So I guess I'll go first. I'm Kristal. I am an patient leader and advocate for the fibromyalgia, chronic pain, and military veteran community. I am an Army veteran that is diagnosed with fibromyalgia and other chronic pain conditions as a result of injuries I sustained while in service. And some of my background, I worked in social services for 20 years on top of the military. So kind of parlaying my professional experience into personal advocacy is natural. And that's how I came to where I am today.
Great.
So, hi, I'm Candace Lerman. I am a rare disease patient. I have a rare blood disorder called immune thrombocytopenia. I'm probably best known for my work in repurposing drugs. I've repurposed a chemotherapy drug twice now to put it in remission. My daily job, I am an attorney. I work in healthcare and pharma. So I do a lot of work with data privacy, clinical trials, and drug development.
Great. Busy right now, I'm sure.
Oh, yes.
Okay, hi, my name is Frank Rivera. I'm also a rare disease patient. I've been working with the rare disease community for about 9 years now. Mainly now working with a rare disease called sarcoidosis, which I personally do have. And my main focus is really early discovery for this disease, because if you get it caught early enough, 75% of the people are go into remission. And unfortunately, I wasn't. So I have it in 90% of my body at this point. So that's my main focus, and also working on mental health for the sarcoidosis patients.
So question for all of you, just how do you feel the role of the patient leader has really changed during the time of this crisis right now?
Personally, for me, I really don't think it's changed too much. It's just we might have changed the narrative where instead of fully focusing on our communities, we have the COVID outbreak that we're incorporating in with our advocacy efforts and reaching out to our community, making sure that, we're giving out up-to-date information from reputable sources, and then tying it in how it can affect our community. The only big change with the COVID pandemic is I've had a lot of people that do not have any medical conditions who are worried and have reached out to me, and that is a new layer because of this. But ultimately, I'm doing what I normally do. It's just, about 50% of my advocacy is focusing around the COVID crisis. So that's the only thing that's changed, is the information.
Mm-hmm.
And for me, it's changed. I'm actually more of a person to person, so it has changed a lot for me. And so in that respect, for me, it's been a little bit different. But I also started this new program that we have an online support group, which has actually worked out really well. We actually had a meeting yesterday, and we had 35 people show up. So we're getting a lot more people to show up this way now, and it's definitely needed at this point.
And I've been seeing a difference from like a business industry perspective, that industry now is looking to patient leaders and some of the established relationships they have, whether it's on advisory boards or with various projects and even in clinical trials right now, to try to get information out into patient communities, whether it's about COVID or if it's about clinical trials that have been interrupted during this point, perhaps with medication or new information coming about as we treat patients on the front line and discover more and more about how COVID interacts with various pre-existing medical conditions. These things are all sort of changing in real time. So it's kind of interesting to watch it sort of at a macro level too, and just seeing how patient leaders are stepping up to help engage with their communities and get information out.
Excellent. So it seems like you all are working in very different areas, but maybe during this time you've had to come together and work together in new ways. So would love to hear a little bit about that.
Well, this is an interesting time because for the first time in human history, we have something that connects all of us together, whether you have a medical condition, chronic illness or not. And I think that despite how bad the situation is, some of the positive is it's breaking down some barriers and silos between chronic condition and chronic illness communities to work together and collaborate. And it's also creating a connection along with increased empathy of those who never really understood chronic illnesses, rare diseases, or invisible illnesses and the risk. So in a lot of instances, I'm finding myself working with advocates and patient leaders that I might not have collaborated with because we're focused on different areas, but this common thread is pulling us together to work as basically one team, one voice, and putting out some of the same messages across the board so that, especially in social media, it kind of beats the algorithms if we're all putting out the same message, so it can get, out to everybody who needs it, whether it's within our communities or the general population.
That's great. Anyone else want to chime in? Did you hit the nail on the head?
Yeah, that's sort of the conversation that we just had when we all decided to team up and work together too. It's just sort of normally we operate sort of in silos depending on disease space and what your initiatives are. If you're running an organization like Frank has for many years and is well known and well respected in the disease community as a source of information, or with Kristal with her advocacy, both for fibromyalgia and for veterans and working with those groups of people. I think all of us collectively have the same requests in survival mode with this pandemic, and the needs of everybody, whether you're sick or healthy, is sort of the same. So it really just kind of broke down those traditional barriers that we've seen in healthcare for years, if not decades, and it allowed us to collaborate.
For me, I think it's also, we were able to take the lead because we have been doing this for so long. So people have been actually coming to me, and like Kristal said, people who don't have any, whether it be rare diseases or immune compromised, they've been coming to me or coming to us and looking for us for advice. So this is a great spot for us to just step in and help people out.
That's great. So I had the chance to chat with We Go Health yesterday, and Julie Kroner, she mentioned an initiative that you all were working on, with retailers having specific hours for people with chronic conditions to be able to shop for essential goods. So would you be able to share some information about that?
Just to preface it stemmed from during the beginning of the outbreak. I actually contracted community-acquired pneumonia despite having an N95 mask and gloves. And at that point, when I contracted it at the time, people were not social distancing as they should have been. They weren't really following universal precautions. And I really got upset because the narrative in the media at that moment and on social media was very mixed. There was two camps: not take it seriously, take it seriously. And so people kind of were just going about their day as normal. And then I ended up in the hospital and I tested negative for COVID, but I was like, this is an opportunity to promote awareness with shopping retailers, why it's so important to instill the social distancing guidelines, accommodating at-risk populations. And so I used my experience to do a personal advocacy initiative. And then I reached out to Candace and Frank because they're very strong leaders and they don't mind a little bit of hard work. And I said, hey, I think we need to address this, and how can we do this? We had communication going back and forth for a couple of days. And then I took everybody's insight, suggestions, ideas, and I put it in a write-up. And Frank put it out on Twitter. He's focused on Twitter a lot. I focused on Facebook a lot. We were like tagging and engaging different grocery retailers to say, hey, it's great that you're accommodating our at-risk senior citizen population, but you have a whole group of customers that you're alienating, and the underlining message is they're not as valuable, and these customers are individuals with compromised immune systems, rare diseases, and we need to accommodate them as well because they're just as valuable to you as a company as everyone else. And then Candace, she's really great with her legal background and kind of helping tweak stuff. And then she added a layer where she was working with healthcare providers to get PPE gear to grocery store employees and her local postal workers. So that's kind of how this came about. And then for those retailers that weren't being responsive on social media, Frank and I would email them, and if we didn't get a good response, then I was calling them directly.
For me, it was actually a local thing that I started looking at because I was seeing a lot of people doing it for the senior citizen, and me being compromised. And like Kristal, I was actually getting sick, and I did get tested, and for me, unfortunately, it was positive. But I was just thinking how before I even knew about my testing and stuff, how was I going to be able to go there, and fear the worst, because my disease is a lung disease. So, I wouldn't want to go in, and I didn't also want my family to go in because they would bring it home to me. So that was where my goal was. And then, when Kristal and Candace, came to me, I was like, I was all for it.
Yeah, that's a wonderful initiative. So congratulations on that. And any other initiatives that you'd want to touch on that you've been working on that you're particularly proud of?
Well, we're going to be starting a new initiative, the three of us.
Oh boy.
It's going to be focused around drive-through employees working at fast food restaurants. I'm one of those people, I kind of am all like, want to come out of the gate running with things, and I have to remind myself to take a step back, think about it, do some research. And earlier in the week I reached out to Candace and Frank again, and I said, hey, okay, we're seeing that these grocery store retailers and essential stores, they're doing the best they can to accommodate their employees, and like they're initiating social distancing, whether it's putting up clear plastic face plating to protect their workers, taping off the social distancing guidelines on the floor. And I had to run out on this past Sunday, and I was just like, you know what, I'm going to treat myself to a Starbucks because, it's been intense and we all deserve a little token of something yummy. And one of the things that struck me was the employees, even these like restaurants, fast food and coffee places, the stores actually closed, the drive-thru is open, and they don't have PPE gear, these young workers. And most of them on average are between 16 and 24 years of age. And the other thing is they don't have any protection. So they really can't put those clear plastic, I guess, I don't know what you would call it, dividers, because of the exchange of the product that you're ordering and payment. And then on top of that, the other thing I, kind of thought about was, if someone orders food at a restaurant, goes and picks it up, they can leave a tip. You can leave a tip at Starbucks, but your average fast food worker is not being allowed tips. And even if you order groceries to be delivered through Instacart or Uber Eats, you can add a tip. And we have these young people who are scared and they're not having the protection they need. And then on top of that, every other place can get a tip, but these young people, the majority of them young people, cannot. And it just didn't seem fair to me. So I reached back out to Frank and Candace. I said, hey, I want to start another call of action about this, because we need to focus and help people understand that every person that's working is at risk. And some of the things I thought about is like really part of this, I still have to do the write-up, but I have that piece together, but these fast food restaurants really promoting that they use, customers use their apps to pay to reduce the exchange of currency or credit cards between the worker and the customer. And so that's going to be another initiative that's going to be starting here shortly.
It's wonderful. Anyone else want to add?
So I'm in South Florida, and we were in the global news over the last couple of weeks because we started getting cruise ships full of people who were sick, trying to port here. And South Florida hasn't really been in the news in terms of its COVID infections right now, but we are a hot spot and we do have massive community spread that's pretty much unchecked. I've been contacted by tons of people who can't get tested despite showing all of the symptoms, from the fever, the coughing, the shortness of breath, not being able to taste and smell food. And they don't know, they don't know where they caught it. They were not around anybody that they know that had tested positive. So I was lobbying very hard with our local leaders, our commission, the sheriff, the Coast Guard, to put safeguards in place for our community, because we couldn't risk having people just get off these ships and then eventually make their way to one of our airports, just because our law enforcement doesn't have proper PPE yet. Some agencies have been able to secure it, but not all. Airport workers, Uber drivers, taxi drivers, things like that, they don't have it. And since everybody on these ships had not been quarantined for 14 days and they were unable to be tested, it was extremely important to protect my county and the people in South Florida from potential infection. In addition, without strict plans for travel, a lot of these people would have been left to kind of hang out in our area for a couple days, if not a week. Just because the majority of them were not U.S. citizens, so they would need to fly abroad and have, transfers and things like that, and we couldn't take the risk. So I had been pushing very hard to make sure that there was a solid plan, and thankfully we were able to do that. And hopefully it will be a model in the future for other cruise ships and different ports around the world to take extra precautions to not only protect the passengers and crew on those ships, but also the local community, our first responders, and our port workers as well.
Incredible. Congratulations. Frank, anything you want to add? No? So next question, just, with your specific communities, what have been the biggest challenges during this pandemic? And, it seems like you guys are coming up with amazing initiatives to combat a lot of those challenges, but anything else that you think is, something that maybe there isn't a direct solution for right now?
Well, for my community, one of them is pretty easy, is the new hydrochloroquine, which is also Plaquenil. My community uses it a lot. And to get that drug now is actually been very hard. And also another initiative or things that I've been trying to do is get the word about the drug, because everybody is like, oh, let's try it. Well, don't you need to know what the side effects are, and and it's not tested. You need to, if it's life or death, that's one thing. But if they want to use that as a preventive drug, people should know, and know the right and wrongs of it. And I think that's one of the big things that I've been trying to get across, because and then there's like the fables. Oh, if you are on Plaquenil, hydrochloroquine, you won't get it. Well, I was on I was on it, so I did get it. So it's not, that's not right. So it's just a lot of the fables is what we're trying. A lot of my meeting yesterday really was about that, is about trying to, tell them the truth, the facts from the fiction. And I think that's happening a lot. And a lot of people are worried. Just like, I don't want to go out. I refuse to go out. I'm afraid to even step out of the house. I'm trying to tell people, yeah, we have to be afraid, but if you're by yourself, take a step in your backyard for a minute. Get outside for a second. Staying inside is not the perfect thing to do for many. Like for me, I've been quarantined for almost over a month now, I think. It gets, it gets kind of boring. And it's not good for your mental health either.
Oh, yeah. And I hope you're feeling better.
Yeah, I'm getting better. It's just a couple of little things, but I'm getting better.
That's good to hear.
And Frank brought up a good point on the hydrochloroquine, because with fibromyalgia, it's very common to have a lot of comorbid medical conditions such as lupus, rheumatoid arthritis. So I have a lot of people within my community and other patient leaders that I know that have those medical conditions, and they're really scared. And there were some parts of the country in the United States that they were having a hard time getting their standing prescription that's prescribed for their medical condition. And providing, I found myself providing support to communities that, although I have a lot of people in my community that have those conditions, I find myself right now, kind of spending more time than I would in normal circumstances advocating for those communities, because, we all matter. Everyone's life matters, and they should not have to wait for a medication. They should not have to only get 7 days supply of a medication, or be fearful that if they don't get it, they'll relapse and then end up in the ER. That's a huge, fear. And, a lot of the challenges I'm finding is really trying to help patients or individuals that don't have a medical condition to reel in that fear, and looking at things a little bit more realistically, and thinking of, outside of the box, some strategies that can help, address these issues if they were to come about. And that medication also is used for malaria. So, a lot of military personnel are worried, like, okay, what if we get sent somewhere and we need this medication and we don't have it because it's not being given, it's not being prescribed, or there's a shortage. So, a lot of times I have to tell people, what can we do if this comes about? Kind of thinking proactively instead of letting that stress build up and that worry, and then coming up with ideas to circumvent if there's barriers to getting that treatment, or any treatment. A lot of us, all of our appointments have been moved to telephone or video conferencing. That is also something that is of concern with a lot of people. I actually had neurosurgery in December, and I have physical therapy, and it's all telephone now. And some appointments are, I find, okay, but how can you really assess someone's progress over the phone? So there's a lot of that worries, and then not getting the medical health care they need, or the fear of, if my illness goes into a flare up or something happens and I get sick with something else, not wanting to go to the ER because they're afraid they might contract COVID. And it's kind of like they're in this position where they're weighing the lesser of two evils. And so that's been a huge concern and challenges that, I've been supporting individuals with, and educating how to circumvent and how to advocate for themselves if they were to come across that situation.
Yeah, it's extremely important. Candace, anything to add? I know you're in the pharma space. Anything you want to add about, the potential treatments out there?
So I've been monitoring just about everything, clinical trials, both domestically in the United States and then abroad as well. Since the EMA, Australia, everybody has been working on different things. So one of the big projects right now, especially having a blood disorder, is the talk of the plasma. Or whole blood transfusions, given the thought that there may be an issue with red blood cells transporting oxygen into some of these more critical COVID patients, which is why people are dying still on ventilators. So I'm starting to work with some physicians and some local blood groups to get the word out about the potential for plasma and blood donations from survivors 2 weeks after the last of their symptoms. And going from there, New York has been spearheading it. In the next few weeks, we'll probably see a more robust system come about for this. It's probably the easiest thing, but my hope is that once we start to sort of level off with the cases and we get this more under control, and as some of these drug cocktails, the hydroxychloroquine, with the Z-Pak, and we have remdesivir from Gilead and a couple others that are looking extremely promising, that perhaps we can start looking at potential blood and plasma donations for high-risk individuals, sort of act as a shield and provide some antibodies. It would be very interesting for the blood disorder community because we're used to receiving IVIG and blood and plasma transfusions. So I've been trying to keep people sort of with their eye on the prize for that ultimate goal, and also speaking with patients who have recovered, who are interested in getting involved and pointing them in the right direction for where they can go to donate blood. We were very lucky in Miami. One of our mayors here unfortunately tested positive, but is recovering and is donating his plasma. So that was fantastic because it was a big PR push locally for people to do that. But our main goal will be antibody testing to understand who possibly had this perhaps a month or two ago and was unaware of their status, because there'll be sort of a honeypot of potential blood and plasma donations that will help contribute to sort of clamping down on the virus, the spread, and hopefully reducing the amount of ICU admissions in the coming weeks.
Yeah, that's wonderful. And if there's anything we can share about donating blood on our resource page, we're happy to do that to get the word out there.
Awesome. Thank you.
Yeah, of course. So to all of you, what advice would you give to other patient leaders out there who are really just helping their communities cope during this time?
So you know what, my biggest word of advice is to work together with other patient leaders and advocates, and along with help share their advocacy initiatives on social media. I just am always been one of those people, I mean, call it the army in me, I don't know. It's just, I believe in working together. I think that you can reach the goal a lot sooner, address things more quickly in a more proactive manner. And so I'm always huge bringing people together, uniting people. And I think that during this time, this is probably one of the most important things to do, especially like I said, in my community, I have people that have other medical conditions. And while I'm familiar, it might be a good idea, hypothetically, for me to do a video chat with someone that has RA or MS or lupus, and bring them into the conversation with my community. So they have that extra layer of support, understanding, and validation from someone that's just like them, in the sense of a patient like me or a person like me that is dealing with this illness. And I just say, be proactive, collaborate, and help each other. I actually, had reached out to Legal Health, Kristen Long, actually, and said, can we streamline all these patient leaders initiatives within Legal Health where they can go to one spot, and it's like a bulletin board where they can kind of just post what they're working on, whether it's surveys or they need emails or phone calls, to go out. And so I put it together, and it is called Call to Action. And we put it on the Legal Health platform because there's so much like social media white noise now that people's initiatives are being lost. And so it's kind of like a one-stop shop, like, oh, Candace is working on this, Frank is working on that, Kristal's working on this, Legal Health is working on that. And we can all go there, find all the initiatives and advocacy efforts in one place. Mm-hmm. Easily, and support each other, and then also share the initiatives with our communities. Mm-hmm. So, you know, that's a simple way to help, you know, address this situation, along with bring people together and work together more cohesively and collectively.
Great. Frank, Candace?
Well, for me, I would say I've had this initiative for about 3 years now, and you are not alone. And I think it really rings true now more than ever, that and communities are not alone, and they need to know that we, you know, like I can go to Kristal, I can go to Candace and say, hey, I need help with this. Can you help me? And I really believe that having that togetherness between communities, between your own community, also shows people who aren't involved in these communities. When it shows that we're working together, it also shows, you know, that maybe they will work together. You know, we're not gonna break this virus by ourselves. You know, it's all of us working together, and if we can do it, why can't anybody else do it? And that's that's what I always want to try to show is we can do it, why can't anybody else?
Yeah. It's good advice.
And my big thing for people who perhaps are running like a nonprofit organization that's disease specific and has a medical advisory board is to sort of watch what's going on in the regulatory space. We've eased restrictions on telemedicine. We've allowed healthcare practitioners to practice across state lines. We've opened up our healthcare facilities, and we're sort of like fast tracking the removal of red tape given the pandemic. But this is something that post-COVID, when we have this under control, we can't change and go back. Because it ultimately hurts patients. Regulatory reform has always been something I've been very strong about. It's why I went to law school and became a lawyer, because a lot of times our frustrations in healthcare are because of lawyers. So we create policies and things that perhaps we feel are protecting patients, but the truth is that they're actually hurting them. So I've instructed a lot of patient groups and patient advocates to sort of keep a list, even if it's just a Word document, of positive news stories where they see regulations helping and negative news stories where they see they're hurting, and then being able to circle back with their organizations or fellow patient leaders to kind of put together a policy proposal, whether it's at their state or local level for state and local issues, or getting ready when they have their lobby days in Congress and we can go back to traveling, to present them on Capitol Hill to their representatives and their staff. But these types of things, especially with telemedicine, I don't think it's going to go away anytime soon. But the important thing is that advocates take these lessons to heart and kind of monitor what's going on beyond just the day-to-day numbers of how many people could be infected in your zip code or people that are dying, but also the regulatory consequences that could end up sparking a new generation of medicine that's going to benefit all patients. And also keeping in mind that at the end of this and the light at the end of the tunnel for us will be the opportunity to pair with industry and pair with health IT and things to collaborate and perhaps form new groups, new apps, new ideas, new websites, new care pathways that will benefit everyone.
Excellent. That's all great advice. And finally, just any last thoughts that you want to share that, anything you haven't had a chance to cover yet?
Well, one thing that for sarcoidosis, April happens to be Sarcoidosis Awareness Month. Mm-hmm. And so one of the biggest things, because, I'm one of the national ambassadors for sarcoidosis. And a lot of the other organizations have come to me, oh my God, we can't have this, we can't have that. I'm like, yeah, but you still can promote it. It doesn't have to be a physical promotion, even though, like you said, we can't travel, I still talk to my representative, and make sure that they're involved. I even go to my talk on the phone. I do a lot of phone calls now, talking to my town council people, my state, my county, everybody, even though, and I also have brought them involved with how it affects, with COVID, and trying to, get them to learn also. I mean, it's a learning tool for them also. And they've all been very, very helpful and responsive also.
Wonderful.
And I totally agree with Frank that any awareness initiatives around specific, diseases, medical conditions, let the show go on. You can structure it to do it on social media. Actually, that's kind of the space I've been working in for years. And I think that during this time, especially with everyone being home, it's an opportunity to get that information out, and more people are going to listen. And then you can add that layer of awareness of COVID with the said medical conditions. So, with all the COVID related advocacy initiatives I've been working on and doing, and then collaborating with other patient leaders on, next month is Fibromyalgia Awareness Month. And I'm still going to steamroll ahead and do everything on social media. And I also think that it's important to do those awareness initiatives for, designated awareness months, because it lets the communities know they're not being forgotten during this time. And then, like I said, you can add in a layer of education about COVID so that the general population can understand how much more at risk we are if we contract it. And, the other point I just want to put out there, both patient advocates, patient leaders, individuals with an illness or don't have an illness, we're very adaptable. Human beings are very adaptable. Our mind kind of sets us back and fooling us into thinking we're not, but we are. And it's just a matter of being creative and restructuring our routines so that we have some semblance of normalcy, and it's important. I had to take a step back this week. I emailed Candace and Frank and said, hey, I haven't done this write-up on this new initiative I want to start. I'm getting stressed out and irritable, like just being on social media too much. I have to take a step back. And they're like, take as much time as you need. And so I could reset and reframe my thinking back into that positive space again. And it's important for everybody to do that. And there's so many creative ways, to promote some of that normalcy and feeling and having those moments of being okay. I'm not saying it's easy. I mean, something as simple as I have dogs, I have to walk them late at night because there's a lot of families in my neighborhood and they're all out right now. So I'm walking them while it's dark. And I'm actually walking them in a shopping plaza where all the stores are closed because there's not people there. So it's just important to, as much as it's important to advocate and connect and work together, it's just as important, if not more so, to take care of ourselves, find creative ways to bring some normalcy in your daily structure, some anchoring activities, learn new things. Now's the perfect time because we all have time. To get through this and manage the stress. And it's okay to say no sometimes as well and not overextend ourselves.
I like that. Candace?
So one of the big problems, particularly in the rare disease community, was the sort of sudden halt of clinical trials, especially for life-saving infusions, gene therapies, you name it. And it was alarming. The FDA has been working to address it. But also from a industry standpoint too, it's shocking to all of a sudden kind of be told, like, if you can't guarantee that your patients won't be exposed to COVID, you need to stop what you're doing. So one of the big things I'm seeing now, and I've been preaching to patient advocates and groups, is that there is a major opportunity for virtual trials, virtual remote monitoring, telemedicine appointments for clinical trials, and even if you're doing observational studies of patient organizations and groups in particular, this is the time to connect and engage. If you're looking to, in the next 6 months to a year, enroll in clinical trials or engage with the patient population for a trial, now is the time to reach out to them. They're online, they're connected, they're not distracted by so many things. And the general population as a whole in the entire world is watching these clinical trials go on right now for either brand new therapies in phase 2 or phase 3, our vaccines, and repurposing drugs already on the market. So there's a major opportunity right now to sort of bridge the divide in health literacy in multiple areas. But I'd say one of the strongest places right now will be clinical trials, and patient leaders will be at the forefront of that. And I think it'll be a very beneficial thing. And that was and now that Kristal was talking about her dogs, that was my dog shaking off because he just needed everybody to know he is here and eating French fries.
Well, that's wonderful. So Kristal, Candace, Frank, thank you so much for joining us today. This has been incredible information, and we'll make sure that we'll have your Twitter handles posted as well. So in case anyone has any other questions, they can reach out to you. But thank you so much, and stay sane and safe and healthy, and we'll talk soon.
Thank you.
Thank you so much.
Thanks for watching this interview. We're doing our best to keep our health community up to date and informed as the pandemic progresses. So please check back for more interviews and blog pieces with leading health experts, as well as check out our Health COVID resource page for more information. Thanks again.